Hi, everybody. Good afternoon. My name is Leslie Gianetta from UPMC Centers Rehab Services. Thanks for tuning in this afternoon. I know the weather is nice out, but hopefully you'll get some good information here to start your exercise program. To give you a little bit of information about us, we are a UPMC company with over 70 locations in Western Pennsylvania. In our Monroeville, we actually have two Monroeville offices, one behind Corporate One, one behind Miracle Mile and Corporate One. We have regular PT, sports, as well as our women's and men's health, which handle lymphedema, incontinence, any kind of pelvic floor issues. Our other office in Monroeville is on Oxford Drive, close to the mall. And there we also have regular PT, sports. We have a certified hand therapist, a speech pathologist, and our balance vestibular training. And just a lot of different specialties within there. Treat MS patients, Parkinson's, upper extremities, a lot of different patients are seen at that clinic. So I'm going to turn this over to Kara. She is one of our physical therapists at the Oxford Drive location. If you have any questions, please feel free to ask. She's going to go over some of the information. And again, thank you for coming. If there's anything we can do to help, please let us know. Thank you. Kara?
Hello, everyone. I'm Kara, and we'll be talking today about starting your exercise program. Now, Mark, is there a way for me to share the presentation?
Yes. Let me do share screen. Wait, share screen. Allow multiple participants.
Okay.
And now you can share.
Okay. All right, thank you. I got it. Thank you. Give me 1 second to get that loaded up here, okay? There. Zoom things keeps coming up. There we go, from beginning. All right, so we're gonna talk about the do's and don'ts of starting an exercise program. So just to start a little bit about me, I'm a doctor of physical therapy and a certified athletic trainer. I graduated from Slippery Rock with both of those degrees. I've been working in Monroeville since 2018 as an orthopedic physical therapist. I have an 8-month-old daughter down here at the bottom. Her name's Sawyer. I enjoy running, walking, and biking. So I'm a good person to talk to you about starting an exercise program. I've run 4 Pittsburgh half marathons and I enjoy traveling. So I especially like the beach and being able to walk and exercise on the beach. All right, so now we'll get into talking about some exercise programs. So this is just a quote from Robert Butler. If exercise could be packed into a pill, it would be the single most widely prescribed and beneficial medication in the nation. And we'll talk about why that is coming up. So this is as part of the exercises medicine movement, and they looked at different things that are different reasons why exercise would help with different diseases. So it's good for health promotion, it's good for chronic disease prevention, like diabetes, heart disease, and things like that. It can actually be used as a treatment for chronic illnesses, and complement with medical interventions or as a substitute, and it can actually reduce or eliminate your need for medication. Physical inactivity actually continues to be an important public health challenge in the US and around the world, but it's more challenging in the US right now. And according to the World Health Organization, or the WHO, they actually found that after high blood pressure, tobacco use, and high glucose, physical inactivity is the 4th leading cause of death globally. And that's in 2004, they decided that. And then more recent evidence in 2009 shows that physical inactivity is the leading cause of death in the US. And they're finding as time goes on, that's increasing as we become more sedentary. They found that more than half of adults don't meet those guidelines for sufficient physical activity that we'll talk about towards the end here. And then in a study of older adolescents and adults, people spend about 8 hours a day in a sedentary behavior. And there's as much as 36% of adults that have no leisure time physical activity whatsoever. And it's actually worse here in Pennsylvania due to, our changing seasons and things like that. So that's why we'll talk about how important it is to start. So this is just a chart to show what, after tobacco use in more recent years, this inactivity and poor diet has been a higher leading cause of death than, a lot of other actual causes of death. So here are some benefits of exercise that we can talk about. So it reduces your risk of health conditions and diseases and actually helps combat them. So with reference to cancer, it can reduce your mortality and risk of recurrent breast cancer. It can also reduce your risk of heart disease and high blood pressure by about 40%, and it can lower your risk of stroke, and as well as the risk of developing type 2 diabetes. And it can also increase your life expectancy. So they say that low levels of physical activity expose a patient to the greater risk of dying, and that's higher than smoking, obesity, high blood pressure, and high cholesterol combined. So, and for older men, regular physical activity can reduce that risk of death by about 40%. Active individuals in their 80s have a lower risk of death than inactive or sedentary individuals in their 60s, which is a very interesting, relationship there. And we're actually seeing a lot of that. Like we have a lot of healthy 80-year-olds that are very active, very, engaged in activities and things like that. And some very inactive, younger people right now that are actually more sickly than some of those older ones. We've also found that adults with better muscle strength have 20% lower risk of mortality and 33% when it comes to cancer specific mortality. There's not really a reason for that. It's not a direct correlation or cause, but they are finding that that is one of the things that lowers your risk. A low level of fitness can be a bigger risk factor than obesity. So it's better to be overweight than unfit with a lower percentage of body fat. So that's an interesting, everyone thinks that they get into exercise for the decrease in body weight, but sometimes if you're fit and a little bit overweight, it's better than being, a small lower percentage of body fat, but not being active. Here are some other benefits. So it can improve your cognition. So Alzheimer's disease can be decreased by about 40% in people that exercise. It improves your mood as well as or better than Prozac or behavioral therapy at times. That's not to say that you shouldn't, take medication or do behavioral therapy, but this is something that can be added to improve those effects. It can also boost energy because your heart and lungs become more efficient at delivering oxygen. And so as you become more active, your energy level goes up. Now, that's not something that happens automatically. It's going to take time of doing a program to be able to feel those effects. So don't give up if after the first week you're still really tired and you don't have energy. It's just because you added something new to your program. And also regular physical activity can protect your joints and prevent falls, which we see as a huge risk factor here in PT. People that have fallen become inactive, but people that, are regularly physically active fall less often, and it decreases your risk of being injured when you fall. So the bottom line here is that exercise is important. You should at least do something active daily. So here is the guidelines that we talked about, the National Physical Therapy or Physical Activity Guidelines that you should follow or work up to following, especially. So we're going to mainly focus on this over 65 crowd for right now, just because that's typically where we see the most benefit. But that's not to say you can't fall into these other groups too. So for people over 65, they recommend 150 minutes of moderate intensity physical activity throughout the week. So you can divide that up however works for you. A lot of people do the 5 minutes or 5 days a week for 30 minutes. And that's just something to work up to. That's not something you have to like tomorrow go out and start 30 minutes of physical activity. Or they say if you're a little bit more active already, you can do about 75 minutes with that higher intensity throughout the week. And we'll talk about what constitutes moderate activity and vigorous activity a little bit later. Or you can do an equivalent time of a little bit of a combination of moderate and vigorous, if that's, more up your alley, you like to change it up a little bit. People that have poor mobility or have trouble getting around should work on exercises to enhance balance and prevent falls 3 or more days per week. And muscle strengthening activities, so using weights, using bands, things like that, should be done at least 2 or more days a week when you're doing like big muscle groups. So we're talking like biceps, triceps, quads, like your legs, your hamstrings, your calf muscles, like anything like that, that you want to work those at least twice a week or more. And then to be beneficial for your cardiorespiratory system, everything should happen in about at least 10 minutes. So even though walking 2 or 3 minutes at a time is still better than not doing anything, the goal is to make it up to 10 minutes at a time. And so we're going to talk about the do's and don'ts of starting an exercise program. And we're going to start with the do's. So first, you want to determine your readiness. So to determine physical readiness, that's something you want to talk to your doctor about. Make sure that you're healthy enough to start. So we have to make sure that your blood pressure is at a safe level. We have to make sure your glucose is at a safe level, or your blood sugar. And we also have to determine whether exercise is going to affect the medications that you're on. Because if you're on blood pressure or glucose altering medications, that can change, exercise can change those levels. So we want to make sure that it's safe for you. So that's where it's important to talk to your doctor before you start and let them know what you're going to be doing and how often. You also want to look at your mental readiness. So is this something that you're ready to start and be committed to? Because if you're not, completely in it, if you're just doing it because, someone told you that you should, it's not really you're not going to really stay committed to it. So you want to think, are you ready to do this? You want to be aware of the health benefits. You want to have the support from friends and family, and you want to look for something that's convenient. So you don't want to, if you don't have access to the gym, you don't want to say that you're going to go to the gym 5 days a week, or, you don't want to say you're going to run on a treadmill, or, things that you don't have. You want to look for something that's convenient to you. So like walks in your neighborhood, walks at a local park, something that's going to be a little bit more accessible there. The next do is that you want to select something you enjoy. So in order to maintain this program over a long period of time, you have to enjoy doing it. So do you like walking on the treadmill and watching TV on, an iPad or a phone or something like that? Do you like walking outside with either music playing or just listening to your surroundings? Would you rather ride a bike? Would you rather swim, dance, golf, play tennis? The list is, the list is endless of the things that you could enjoy doing there. But the important part is finding something that you enjoy. The next thing that you want to try is to find friends that also like to exercise, or family members or something, so that you can make it a social event. So maybe instead of going out for dinner and drinks, you could try going for a walk or going for a bike ride, or something that's going to be a little more active. If you're not bored while you're doing it, you're probably going to continue doing it. You want to make it a positive social experience. You don't want to make it something that's stressful for you. And you want to push each other to stay with it. The next one is to consider joining some kind of class. So there are lots of classes available. Even with COVID, I know that this is a little bit harder for people right now. But there are classes at Planet Fitness. There's some at Crunch. There's Silver Sneakers. There's some at the Senior Center. There's some that come on virtually that can do, things for you. They have different classes for all ages and activity levels. They have some things that you can do like seated in a chair that are still active, like chair yoga and different things like that, that could be, more structured to help you get started. The next do is, and this is actually when you get started, like once you've picked what you're going to do, this is the next step. So we want to make sure that on the day we're going to start our activities, we're going to warm up. So cold muscles basically act like a piece of plastic. They don't stretch, they don't adapt, they don't move very well, and then you have risk of hurting yourself. So what we want to do is walk a few laps or ride a bike or something to just warm up the muscles, get them ready to go. And then you want to stretch beforehand. So you want to improve your range of motion, your flexibility. So some gentle stretches after your warm up. The general rule of thumb is that you should do 60 to 90 seconds of a stretch. So that's broken up into, 3 times 30 seconds. So you stretch for 30 seconds, you take a break, and you do that 3 times, or something to that effect. That's what you need in order for the muscle to even realize it's been stretched. The other important part is that you stay hydrated during your exercise, especially for people with low blood sugar, high blood sugar, or low blood pressure or high blood pressure. It's important to stay hydrated throughout your activity because that will affect what your heart does. And you don't want to wait till you feel thirsty. You want to just drink from it regularly. So find, even if it's like every 5 minutes you take a drink, or every 10 minutes, you want to find like a rhythm there that works for you to make sure that you're getting adequate amount of hydration. And I actually keep my water bottle with me at all times. So it's right here in the room with me while I'm giving this presentation to make sure that, I stay hydrated too, even if I'm not exercising. You also want to find the right intensity for you. So working out too hard is going to increase your risk of injury, and not working out hard enough is going to not really, benefit you in the long run. So you want to find, when you're doing weight training, you want to find the weight that's right for you. So here in the clinic, we usually start with a weight that you're able to perform not easily, but with a little bit of challenge at 2 sets of 10. And once you feel like that's easy, then we start adding and adding and adding. And if someone's able to perform like 20 reps at a time without taking a break, then it's time to increase the weight. But if they're, jerking as they lift it, or they can't go slowly on the way down, then that's probably too heavy. So we back down a little bit. The next do is you want to plan when to be active, and you want to plan when to rest. So when you're talking resistance training, and this is your weights, your bands, things like that, your body needs time to recover. Those muscles need time to heal, because basically what happens when you do resistance training is you break out those fibers in the muscle, and then they form a little bit stronger every time you do that. And as you increase your weight, they do that each time. So they still need a day to recover in between. And so we say that you should perform resistance exercise 2 to 3 times per week. Especially if you're doing the same program over and over again, you want to, break that up a little bit. Now, if you're doing aerobic exercise, so we're talking walking at a brisk pace, running, biking at a higher intensity, things like that, you want to plan to be active 3 or 4 times a week, and then work up to 5 as your fitness level improves. Now, that doesn't mean you want to start with 30 minutes on day 1. That means you want to start with 3 days a week, maybe 10 minutes or something, at least 10 minutes, but maybe that's all you can do on the first week or so. And then you can increase as you improve. Now we'll talk about some don'ts. So we don't want to overdo it. We don't want you to fall during your exercise. We don't want you to get injured. So you always want to make sure you're performing exercises properly so that you're not getting injured. So damage to muscle, tendons, or ligaments can make you hurt, which is going to make you less likely to want to participate in exercise. The saying that's really popular, and people say it here all the time, no pain, no gain, right? That's not the case. We say no soreness, no gain. So you have to listen to your body. If it's pain, like sharp stabbing pain, you stop and reassess. It may just mean your weight is too high or you're not using appropriate form. So you may have to ask for help on that to make sure that you're doing it right. Or, you may just be, doing too many reps with that heavy weight. So those are some things to be careful of so that you're not getting hurt. Soreness in the muscle that goes away when you stop, or, that heaviness feeling in the muscle when you're doing exercise, that's normal. But we don't want there to actually be sharp stabbing pain. The other thing we don't want you to forget is to breathe. A lot of people here in the clinic, and when I've been to the gym, other places, you can see them like holding their breath as they lift these heavy weights and everything. And that's not good for our hearts. That's not good for our lungs. It's just not a good, habit to get into. So we say that you should inhale during the rest phase or the easy part of the exercise, and then exhale during the hard part. So like if you're talking like a bicep curl, you want to come up and then you want to exhale as you go down. So inhale as you go up, exhale as you go down. Okay, just to make it a little bit, you know, make sure you're getting your breathing in. Okay. The next thing is you don't want to start at too high of an intensity. So the American College of Sports Medicine says that 30 minutes of moderate physical activity is sufficient. So you don't have to, you know, walk the fastest, run the fastest, bike the fastest every single day. Moderate intensity activity. And like we'll talk about at the end what that constitutes. And we don't want you to set unrealistic expectations. So no one's perfect. You're going to skip a workout. You're going to eat poorly on it a day. You know, even if it's your birthday and you have some birthday cake or something, you're not going to be 100% perfect all the time. We usually talk about the 80-20 rule here. So like 80% of the time you eat well, you do your exercise and things like that. And 20% of the time you kind of eat whatever you want and you might skip a workout here or there. But so that works like to the five days a week of exercise, 2 days off. And then if you're working for a weight loss goal, you want to set that goal. The safe level for that is 1 to 2 pounds per week. And that depends. Like if you're a smaller person and you don't have much to lose, 0.5 pound to 1 pound is appropriate. If you have a little bit more to lose, 2 pounds is a little bit more appropriate. But you don't, it's really dangerous to try and lose weight at a rapid rate. So you want to set those small obtainable goals and make your goals something and make your like reward for achieving that goal something that isn't food oriented. Make it something that, you know, like, because some people do like, oh, I'm going to get a donut if I lose 5 pounds. Well, that's kind of counterproductive there. So you want to do something like maybe you'll buy a new outfit to work out in. Maybe you'll buy, you know, weights for home or bands for home, or, you know, make it something that is motivating to you, but also isn't going to ruin your progress. And then another don't is that you don't want to get stuck in the same routine. Once you find a comfort level of things that you enjoy, you want to try something new. So maybe that means a new piece of equipment, maybe a new class that sounds interesting. Maybe you want to try swimming for exercise or a, you know, water aerobics class. You know, just try and change it up. If you like walking, find somewhere new to walk. You know, there's a lot of trails around here, which is really nice. I know the Rails to Trails in Monroeville is a very nice place to walk. I know there's a couple parks around here as well. And even going outside of your comfort zone. So going down to the city to walk, around the rivers or around the point. You know, there's some state parks nearby that you could visit. So there's a lot of different places that you could walk in this area. So, or get exercise in some way. And you also don't want to work out randomly. So you want to find a schedule that works for you, that fits around your schedule. You don't want to just, you know, randomly decide on a single day that you're going to work out, but then not do it for, you know, another month or so, because then that's not going to help you improve. The next thing we'll talk about is how intense your exercise should be. So aerobic exercise should be at a moderate level, and then you want to work up to a vigorous level. But even if you're comfortable at that moderate level, that's okay. But the way we determine this is we use the talk test. So a moderate pace will slightly increase your heart rate and breathing, but you should still be able to talk. So this is where it's nice when you're going for a walk with friends. Now, moderate intensity exercise is actually once you get to the point of somewhat hard. So you're breathing a little faster and you're having a little bit of difficulty talking. You might need to stop to take some breaths in between your sentences and things like that. Then we get to that vigorous that increases your heart rate and breathing to the point where it would be very hard to maintain a conversation. And I'll show you on the next page. This is the rate of perceived exertion. So we talk about 6 to 11 being fairly light. So this is how you feel like when you're not doing anything. So you are lying in a bed or sitting in a chair watching TV, you're nice and relaxed. 12 to 16 is our target area. So we want it to be a little bit hard or even a little bit more hard. And this is how you feel when you should walk or how you should feel when you walk or exercise or do activity. Now this hard, very hard, or the very hard, very, very hard and maximum are how you feel when you've done the hardest thing that you've ever done. So this is climbing all of the steps that you've ever done, or, you know, running as fast as you can away from something. So we don't really need you to get in that level. We want to stay more in this green area. So the hard to somewhat hard and hard area. Okay. The next thing we're going to talk about is resistance. So we always say, like we talked about a little bit before, you want to be able to lift it about 10 to 15 times. And if you can lift a weight that many times, you've achieved moderate intensity. So what we usually tend to start people on are more repetitions with less weight to reduce that muscle soreness. And then you can work up to your weight. So what that means is maybe starting at 1 pound of 20 repetitions, working your way up to 30, and then you can up your weight to, you know, that 3, 4, 5 pounds. And then as time goes on, you can get higher reps and then higher weights. And then we say that you should do 2 to 3 sets of all major muscle groups. What that means is sets and reps. I know that can be a little confusing to people sometimes. So your reps are how many times you move the weight, do the bicep curl or something like that. Your sets are how many times you do the repetition. So we usually here in the clinic, we use a lot of 2 sets of 10. So we do 10, you know, of something. We take a break for 1 minute to 2 minutes, and then we do 10 again. So when you're using higher weights, you do less reps. And that's where you fall into that strength building, increased muscle mass. So that's where, you know, you're really trying to tone up those muscles. The low weight, so using less weight with higher reps, so doing, you know, more of them, is more in the muscle toning group of, you know, that's where we prevent injury. And that's what we focus on here in therapy a lot of the time. And so this is going to look like a lot of information on a page, but this is just something so that you have it. These are some tips to get it started. So if you've been inactive and you're considering getting in a program, we always say to try and get in a structured, supervised program, because that's going to give you some sort of routine. That doesn't mean once you get in, you can't, you know, change up what you're doing. It just means that will give you some structure of something to do and, you know, be accountable to before we get started. We don't want you to push too hard at the beginning, because a lot of people, what they do, like if you think of like your New Year's crowd, they come in on the first day of January, they go really, really hard. And then on January 2nd, they're so sore and they're so that, you know, they're hurting so bad that they can't do anything else. And they quit their program before they get started. If you've been inactive for a long time, you want to start in very short sessions. So 10 to 15 minutes here and there. And you want to add 5 minutes each session over the first 2 to 4 weeks. And then over time, you can build up to that 30 to 60 minutes a day on most days of the week. So this is where that 80-20 principle comes in. And then if you have joint problems or health problems, you want to do less reps with that muscle group, but we also want you to avoid or to not avoid doing those joints. So like some people will say like, oh, my knees are bad, so I don't do any exercise for my knees. Well, actually that can make it worse because you're not building the strength around your knees to help prevent injury. And then also we want you to rest as you need to. Here are some, we're going to continue on to some tips. So don't hold your breath when you lift. We talked about that before. You want to avoid unstable surfaces. So you want to keep your exercise area free of hazards. You want to use a wall or a chair, or, you know, we always say a countertop, in order to, you know, keep yourself balanced. If you take medication, make sure that you're aware, that you talk to your doctor about how you'll respond to exercise. So like we talked about before, blood pressure medication can kind of affect the way that your body responds to exercise. So we want to make sure that that's safe for you. So always talk to your doctor about that. You want to always do a proper warm up and cool down, so that we warm up the muscles, we cool them down when we're done, to prevent most of the soreness. You're still going to be sore when starting a new program, but we want to, you know, minimize that as best we can. You also want to make sure that you stay hydrated. which we talked about, and if possible, to measure your blood pressure before you exercise, just to make sure that you're safe. It's not something you have to do if you're regularly normal, but if you tend to run higher, you always want to check on this because your medications may need changed. We always say that anything greater than 200 on that top number or anything higher than 115 on that bottom number, you should definitely consult your doctor because your medication may need altered because it's not doing what it needs to do. Now, the caveat to that is you always want to check before exercise when you're sitting and resting, because if you do it afterwards, the exercise can increase your blood pressure. So that can scare you if it goes up that high. But it's actually a normal response to exercise. So you always want to measure before you start exercise on those ones. So obviously this presentation is for informational purposes only. You should always talk to your doctor before you start an exercise program. And this was general information for, the general public. So we don't want you to take what I say in stone without talking to your doctor first. Okay. And if you experience any pain or difficulty with exercises, stop and consult your healthcare provider. So that can be your PCP, that can be a direct access physical therapist. It could be, a physical medicine doctor or anything like that. But make sure you, consult those doctors or whoever before you start, okay? And above all else, when you exercise, it's important to have fun so that you continue doing it and that you're safe while doing it.